following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Welcome to the Empower Hour with Greater Nashua Mental Health. The Empower Hour will provide information and support about mental health, substance use, and behavioral health. Our goal is to share inspiring stories about transforming lives, to strike down stigma, and to encourage our community to reach out and get help when needed. Mental health is part of all of our lives. It's time we talk about it. I'm Dr. Cynthia Whitaker, President and CEO of Greater Nashua Mental Health, and it's time to get empowered. Welcome to the Empower Hour with Greater Nashua Mental Health. I'm Dr. Cynthia Whitaker, the President and CEO at Greater Nashua, and we thank you for watching the show. Today with me, I'm delighted to have Julie Christenson Collins, who's been with the agency for just about 5 years. She's currently the Program Manager of Substance Use Disorder Services and Drug Court. So I'd like to welcome Julie to the show.
Thank you so much for having me. I'm excited to be here.
Oh, thank you for coming and having this conversation with me today. So tell us about your journey of joining Greater Nashua. So I just mentioned you've been with us for just about 5 years. So
yeah,
what was that like?
So I had moved to New Hampshire from Massachusetts, and when I was looking for work, and when I saw this, I was really excited. Both because of the agency, Greater Nashua Mental Health being the community mental health center, and also because it was working with the drug court program. And for me, I didn't have a ton of knowledge about drug court, but I knew that it was a very well-researched program that had a lot of standards, evidence-based standards for the model. And so I was really excited to be involved with something that had been shown to have really good outcomes.
So you started with us as the coordinator of drug court, and you stayed in that position for quite some time.
And it's been great. So in that role, I coordinate the drug court program and team. So in addition to Greater Nashua Mental Health providing the program coordination, the treatment services, and the case management services, we also are part of a larger multidisciplinary team that's overseen by the court. It's a legal and treatment program, and so we have a lot of legal team members on board. The presiding judge, we've got the county attorney's office is involved, the public defender's office, police, probation and parole, the jail is involved, and we also, the recovery community is involved through Revive Recovery.
So a lot of people on the team to
Yes.
kind of come around the participants of the program.
Correct, yes.
So what does the program look like for a typical participant? So somebody joins drug court. What do all those people do for that person? What does that look like?
Sure. So just to start off, somebody would come into drug court as a participant because they've got legal charges, pretty serious legal charges that they've got, felony level charges, and they typically might be going to prison. So this is an opportunity to stay out of prison and get some treatment for substance use disorder and other issues that might kind of lead to criminal behavior and criminal activity. So they're essentially, pleading guilty to the charges, and the sentence is drug court. And so they come in and they do a lot of treatment. They have a lot of supervision in the community in order to help them kind of, return to, a recovered and functioning member of the community. And so the team's job really is to, the treatment providers provide the treatment, the case managers provide case management. And then in terms of the rest of the team, as well as the treatment providers and case managers, we really look to use a behavioral modification approach. So the use of sanctions and incentives to really encourage people to invest in treatment when they might not initially have that internal motivation. And so the court obviously, can impose the sentence if somebody's not willing to engage in the treatment program. But we use smaller sanctions, and people come to court every week. to kind of report on their progress for treatment and toward their goals. And so if they're not, if they're engaging in, infractions of rules, they can be sanctioned. It might just be a warning. It might be community service, 2 hours, something like that. But we also do a lot of incentives because we know that's the way to promote behavior change.
Mm-hmm.
So we do a lot of praise from the judge. We do a lot of applause. We do a lot of certificates. We do a lot, it's just recognition of the hard work that they are doing and the steps that they're taking to move forward. And so that's kind of what the team focuses in on.
And I would think that participants aren't used to getting that positive recognition from many people on the team. I mean, certainly as a clinician myself, people are used to having a provider or a therapist say, good job, you're doing well, but probably not a police officer or a judge or someone like that.
Or the person who prosecuted them, right?
Right.
And so that's we really make it a point to spread out the praise. So like if we're going to give someone recognition for something in the courtroom, we're probably not going to have the therapist say it because they've already probably talked to the client about it, right? So we're going to have maybe the prosecutor, give them kudos or a shout out as we call them, or the police officer, or, certainly the judge is very involved with everybody in kind of recognizing their efforts for sure.
Well, I mean, that alone sounds like a very different experience than what people are probably used to.
It's a very different model. It really is. We want to work with the client, and our goal is to help them be successful in treatment and in their life.
So what do you say to people that might think, oh, this is like a quote unquote get out of jail free card? I mean, I certainly know it's not, but I'd love to hear, what would you say to somebody that has that thinking?
Yeah, I mean, I think there's a couple of things I would say. One is, for the individuals that come into our program, they typically have pretty long histories with the criminal justice system. And so they've been incarcerated before, many of them, and it hasn't been successful in helping them make the changes they need to be successful in the community. And so this is an opportunity to really think about long-term success. The other thing is it's a lot of work.
Yeah, for sure.
It's a lot of work. Initially when someone comes into the program, they're getting a lot of intensive treatment. They might be in treatment 9 or 10 hours a week. They would be going to court once a week to, answer to the judge. They would be seeing their probation officer once a week. They would be getting drug tested 2 to 3 times a week, meeting with their case manager. So it is a lot of work. And we provide a lot of intensive supervision to participants in our program as well. So there are probation officers who are very involved. We're seeing people multiple times a week. We have police officers in the Nashua community and in Hudson who do curfew checks for us to make sure people are home during curfew. So it's kind of, it's not a get out of jail free card. It's different than jail, but it's a lot of work too.
Yeah. So, and you mentioned people really maybe start without the internal motivation and investment, and that a lot of this support initially is to help people maybe shift from that external motivation to an internal motivation. Have you seen that happen for many participants over time?
I mean, I think it happens for most participants over time, right? I think it's very, very common for people to come in and only be coming into the program because their other alternative is the prison, and, people don't want that. But as they start to, first of all, as they start to work on stopping their substance use, their mind gets a little more clear. They're able to function at a different level, and they really start thinking about their future and what they really want. A lot of them, once they are abstaining from drug and alcohol use, they're able to have different relationships with family members, with children, and that's really motivating for people once they kind of see the positive effects of that. So I think it's really common that people, come into the program, just to avoid jail, but maybe intending to keep on living the lifestyle or thinking it's, it's going to be easy to change it. And then once they really start making the changes, they're like, wow, this is a different life. And there's things here that I really want. And I want to, I want to do this even if drug court weren't here. I want to continue down this path.
I mean, the vision in my mind is like the upward spiral, right? Somebody starts one step in season and then it's like, oh, there's more. And so even if somebody took the first step for, the wrong reason or maybe not quite the right reason, it doesn't matter. What matters is they took the first step.
They took the first step and it's putting them on the path forward. It's all about baby steps. I mean, I think, for a lot of folks, it's probably unrealistic to think they can, think that far in advance at the moment, right? If they're actively using, and maybe they haven't had a lot of success when they've tried to quit before, So I think you kind of have to have those first few steps and kind of build on that and continue on.
So how long has the drug court program been here in Nashua?
So in Nashua, we've been around since 2014. It started because my understanding of the story is the judge approached Greater Nashua Mental Health because she really wanted to have a drug court, and Greater Nashua said, we'll provide the treatment. And they did that to get started, and then eventually were able to secure some federal funding to kind of expand the program. Since then, the state of New Hampshire has been providing funding to the court system and to the counties to establish, or to the court system to establish drug courts in counties that want them. So we've been around since 2014.
Yeah, it's of course a topic near and dear to my heart because I was very involved in the drug court when it was beginning. Some not a little different, but so I appreciate your grace with that. But it really is cool, I think, that this partnership has existed for so long, and to just see how much it's grown and changed over time. I mean, from just one of a few drug courts in the state to now the state having, a statewide system of courts and, a state coordinator. And
yeah, I think one of the greatest things that I really appreciate there's a lot of things I really love about drug court and appreciate. And one of them is that we're always looking at the program and looking at what we could be doing better and look at what we could be doing differently. There are drug courts nationwide, and there's a lot of research that's been done on them and has been continuing to be done on them. And so we get new information all the time, and it changes the way we run our program. When we first started, we had the treatment, and then, people graduated. We have since then brought on recovery coaches who kind of are people themselves in recovery, who can kind of walk alongside participants and kind of share their own experiences in a way to kind of coach them along, and to really also get them connected to community supports in ways that the rest of the team can't do as directly. So that's one way we've changed, certainly, and a lot of the legal processes and things we've tweaked them over time as well.
Yeah, I remember when we brought recovery coaches on, and just what a difference it made for the participants.
I think it really
engagement. To just have that other person who's kind of lived the journey, and plus provide hope.
Provide hope is a huge thing. Nashua can be a small community, and so a lot of times, people have known each other back in the day, and so saying, well, if that person can do it, I can do it. And actually, we hear that people say that a lot about other participants. Well, I know so-and-so in the program, and if he can do it, I know I can do it too. So there's a lot of hope.
Hope and importance of community, it sounds like, too.
Exactly. I think it's possible to get through the program just because we have a lot of accountability and a lot of supervision, but really what makes people successful in the program when they're willing to take that next step and really work to build their community with positive recovery supported people. And so we're treatment providers, right? And so we're positive, but we're involved with people professionally, right? And so having them kind of develop those relationships with other people in the community or other participants in positive ways is really what's meaningful. And I think the participants a lot look to each other for encouragement and support. We recently, one of the incentives we recently kind of implemented was, a peer recognition. So we have big, like ballot boxes essentially, and someone in the program can fill out a slip kind of recognizing another participant for something that we may not be aware of. We might be or we may not be aware of. And so we recently just started doing that, and I have to say the response was really, really overwhelming to me. And to see them kind of, so that we get the slips out and we assign them up to team members and they kind of read them out loud. Mostly they're anonymous. Sometimes somebody puts their name on it. And to see, the people receiving them for stuff that their peers are recognizing is, I think, really meaningful and motivating.
Yeah, it reminds me of the concept of like creating a recovery team.
Yes.
Right. And like you say, that's not the provider's long term. We're part of that team short term for sure, but not long term. And so to have people in your community see the things in you, you start to trust you can put people on your team.
Exactly. And, I think the other thing, it kind of speaks to as well is a lot of participants in the program, when they get to a point where they're feeling stable, where they're moving forward towards those goals, they want to pay it forward to other people, right? And so we have a lot of, participants in the program who are further on or who have graduated, who really are there for the people that are, new and maybe struggling in the program, to provide that kind of encouragement and coaching. And I know it's tough and it stinks, and this is how I handled it, and this is when it made a difference for me when I did this, so I think that's really amazing, honestly.
So in all of your time in the program, I mean, clearly you've seen lots of success in people graduating, and I'm sure some struggles too. Is there a story or something that maybe highlights for you some of the important factors that lead to success in the program? Or
So one of the things we hear all the time from participants is, it worked when I stopped fighting and I took the recommendations of the people around me. I mean, that is such a common refrain. I probably hear it once a month from someone in court. So I know that a lot of times is what the participants think. I do think it goes to the larger issue of community, really, and having a person find that both the community and meaning for themselves, right? And so the folks who have been the most successful have been willing to, get engaged in recovery support programs, whether it's AA, NA, Smart Recovery, Revive Recovery, different things like that, and kind of build that community for themselves. So they have people that they can rely on and people that they can help nurture too.
Yeah, I mean, what you said reminds me of like surrender, right? Like I stopped fighting, I surrendered.
Yeah.
But in order
We hear that all the time.
I'm sure. But in order to surrender, you have to feel safe.
Yes.
Right? You have to trust.
Yes.
And so there's maybe something about the context of this team and the hope in the community that allows people to have that psychological safety and trust.
We really do try to establish a trusting and, positive relationship with people where they know we care, even though we're professionals and we're, and so we do a lot of things to try to make people feel more comfortable with us. For example, we don't want to judge or punish people when they slip up and have use a substance, because we know that that's something that they're struggling with. And so we thank them for letting us know that they're having trouble, and we work with them on a plan moving forward. Now, if they don't follow the plan, that's where the accountability piece comes in, right? But it's not it's not, we never want to have the person feel alone when they're struggling with something. The other thing is, the judge meets with everyone, initially once a week. Then as they stabilize, it's maybe biweekly or monthly. So she really gets to know the folks over time and have those conversations. And so I think they kind of recognize that they can share stuff. They see how we operate the court. We try to be consistent. We try to be fair, and so I think that helps people start to trust us as well.
So when you think about a successful graduate,
Yeah.
does that look like one thing? Does it look like many things?
Nope.
What does it look like?
It looks like so many different things. And, we've got, folks who have graduated our program, have enrolled in college, who are, almost everybody's working when they graduate, unless they have maybe a pretty significant medical issue. But people who are working, pretty well-paying jobs or pretty high responsibility jobs, maybe managing other people who maybe have not had much of a work history before, which is really great. But it also looks like, someone who has reunified with their children, right? We see that a lot. A lot of participants coming into our program don't have consistent relationships with their children at the time they're coming into the program because of their substance use. The kids might not be in their care in many situations. And so that's one of the first, it's one of the things we often hear from people as they start to abstain from use and get stable is, I want to work on getting visitation. I want to work on custody issues. And so people tend to make, really significant gains toward that overall.
One of the other things that comes to my mind is education. You mentioned
Yes,
college,
yes.
but it might even be a high school diploma for somebody,
Absolutely,
right?
absolutely. And again, we recognize progress where it is. There's some folks that it's going to take them a while to get their high set, or which is what the GED is kind of called these days. And so, the fact though that they're attending classes consistently, when before they would be completely unwilling to walk in the door of a school, if they've had, negative experiences in the past. And so those are successes too. Yeah.
The other thing that's kind of coming to my mind is we made an intentional shift to put drug court and the substance use disorder services program in integrated care, right, in our integrated care department. And some people kind of were like, why is that? But as you talk about drug court, it really is whole person care, right?
It is.
So yes, we're doing this substance use disorder treatment, but I mean, you're mentioning work and school and parenting and all kinds of skills that being in drug court really helps a person develop as a whole person, not just let's just do your substance use and make sure you stop using.
Right. I mean, and again, I think it speaks to the fact that, for a lot of people, in order to be successful long-term in kind of managing their substance use, they have to build a recovery, right? And that's what recovery is about. It's about work, it's about family, it's about community, it's about meaning, and so we really do work to help people with that as well.
Yeah,
it's important.
Finding meaning, finding purpose.
Yes, yeah.
Yeah, because sometimes people end up using substances because they lose contact with that bigger purpose of life.
Yeah, exactly.
Yeah. So what do you notice any other differences kind of in the 5 years you've been here? So you've mentioned a few programmatic ones, and I'm just curious, any other things that kind of come to your mind?
I think, I think, again, we've really worked to strengthen the program. I think that there seem to be more services out in the community than when I first started, which is really important. When participants come into the program, they may need other services that we can't provide within the drug court program itself, right? They might need more intensive mental health services. So we can refer to other programs within Greater Nashua for additional supports. Maybe someone really struggles to take their meds on regularly and consistently. And so they might get a support worker that works with them around medication issues and some other issues around managing their life. Or they might need medical care. A lot of folks come to us and they're not, they might have some chronic conditions that they haven't been treating or managing. And so they need care around that. So we can refer them internally or externally, for those types of services. I think there's much more sober living in the community than there was when I first started, which I think is really helpful to people, both in giving them a safe place to live while they're going through treatment and also kind of establishing that community for the long term.
What about the support for the program or the understanding, maybe its validity? Have you seen that shift over time too?
To be honest, I feel like since I've come on board that there has been a lot of support for drug courts within Nashua and at the state level. I know that wasn't always the case, but I do think that overall there is a lot of support. I think that people do still have a lot of questions, like you mentioned about, a get out of jail free card, or kind of even what the focus is of the treatment or different things like that. But I think one of the amazing things is the support of the community towards drug court that I feel like has been there at least since I started.
Yeah, I mean, I feel that for Nashua, for a lot of things, we're really lucky in this community that there's a lot of community collaboration and support for mental health, for nonprofits, for all kinds of supports in our community.
Yeah, I agree, and I think it's not necessarily that way statewide for other drug court programs. And I think we are fortunate to be down in Nashua where we have that level of support and additional services in the area. So, I mean, I do think the state didn't always fund drug courts, and then I think that was maybe 4 or 5 years ago that it started doing that, and I think that's huge because I think it would be hard to support the program without some support from the state.
Yeah, well, and I think it probably brings support to the teams too, to know others are doing it, to have colleagues to talk to
do that, and also to have trainings, right? So because there's so much evidence out there and research being done, in order for drug courts to be effective, we have to know what works and what is what's counterproductive. And so, I think the state has, at the state level, that's been a big goal, is to make sure that the drug court team members are trained in best practices, in the latest research, and work with us to help us implement those things.
All right. So instead of us needing to find things on our own, the state's helpful in bringing some of that in because of that commitment to make sure we're really providing the best care we can.
Exactly. Or if we feel like there's things that we would want to learn more about, they're helpful in kind of, going out and getting that and bringing it to us for sure.
So we talked a lot about drug court, and I know your roles recently shifted a little bit in that we're bringing kind of our more traditional substance use disorder services and drug court services a little closer together, so they're not so siloed and separate.
Right.
I'm curious what some of the benefits you've maybe noticed of bringing those two teams closer together, or maybe what you've noticed about differences between the two.
So in our community Sud program, it's a little bit different because it's, people who are in the community who think they might have a substance use disorder, or know they do, or someone's telling them they might and they're seeking treatment, are coming for evaluation and then outpatient services that we provide at Greater Nashua. And so I think in many ways, it's the same and different, right? Like, everyone is so different, but there's a lot of commonalities across substance use disorder. The drug court participants have the additional issue of criminal involvement and pretty significant legal issues hanging over their heads. But then again, we see people in the community program that also are facing legal issues due to their substance use. And so I think there's an opportunity having the closer working relationship, I think, benefits both programs, because for the drug court participants, when they're completing the drug court program, they still might be interested in some treatment, right? Maybe, some ongoing support, to continue to prevent relapse, right? Or maintain their recovery. And so we can transition them over to the community Sud program for therapy, or, maybe a weekly group or something like that. For the folks in the community Sud, we've got a lot of knowledge and training that we've got around substance use disorder by virtue of, our drug court trainings that we can share with them as well. And so I think it's really mutually beneficial.
Yeah, so there's like a give and take,
Yeah.
a giving and receiving of sharing all the knowledge and expertise that
Exactly.
the drug court teams developed over time. But
Exactly. Or, sometimes, they might be working with someone who's got a legal issue, and we're not lawyers, we can't give advice, but, knowing, the team can reach out to us and we can say, oh, well, why don't they call this place? And they can probably get the information they need from the clerk at this court or whatever it is,
yeah, interesting.
Yeah.
So do you have a highlight, if you were to stop and think about like the 5 years, like a high point story of a moment that like, this is why I do this, or that just highlights something for you?
So for me, every time a participant talks about their community and kind of what they found meaning and purpose in, it's like I get emotional inside, because to me that really gets to the heart of it. And you can see all these, outward behaviors on the outside, like, they're working or they're in school or, they're doing this, they're doing that. But when they kind of speak to that, I know that that's kind of what's driving it for them, right? Is that sense of community and belonging and giving back, or, just kind of, I don't know how to describe it, but just kind of learning that they have a positive role within the Nashua community or the Hillsborough County community.
Like figuring out that they have worth, they have something to give, that they're wanted, they're appreciated.
Yeah. And I think, again, just for me, it always blows my mind how open people are in wanting to share that with others that are maybe not as far along down the path. That's what really gets me is, they're not saying this for themselves. They're saying this to help the person sitting next to them who's struggling, right? Like, and so for me, that's meaningful. We have graduations. Periodically, we kind of do these biannual celebrations right now, because otherwise we'd be having a graduation like every 6 weeks, and we can't do that. But, we have the graduates speak, and they talk about, kind of their story in drug court, or maybe their story in life, and kind of where they are now. And, it's just moving. It's just really moving. And I think, for so many of them, it involves, their families and their kids.
Yeah, having attended some of those graduations in the past, I mean, there have been some stories where there's not a dry eye in the room, or they're just can be so moving.
Yeah.
To see somebody, I mean, you've mentioned it before, who wasn't connected to their family when they started, and now their family's there to watch them, celebrate graduation, and it just can be so moving.
It really is. The graduations are, of course, I'm the one that's running around doing the work to get them set up, but then when I go there, I'm always like, oh, this is why we do this work, because people are up there and they're just, talking about where they are and where they want to go, in a realistic way. And it's just very moving.
And it's funny, we call it a treatment program.
Yeah.
I mean, as you describe it, though, it's a transformation program.
Right.
Right. It's not just going to treatment, going back home, and hoping you can figure out how the treatment can help your life. I mean, we literally are helping people make transformative change into life of recovery.
Right. And that's what we really, try to talk to the participants about. This isn't about now. This isn't about drug court. Like, this is about your life. This is about recovery. And recovery is possible. There's hope. And they see it because they see the people involved with our program who are in recovery, right? And we try to educate them on, steps they can take to get there, and give them some choices about how they want to pursue it. But ultimately, that's what we're hoping for them.
Yeah, I remember having done some work with drug court and having conversations about, like, you could take the path of just check the boxes.
Check the box, yes.
Right, but if you check the boxes, you graduate drug court, you might end up having legal trouble again and coming back for round 2.
Yeah.
But if you truly engage and let it sink in and figure out that purpose of life.
Yeah. And, I'm thinking we did have, we've had participants who have come in and have kind of checked the boxes and have had people return. And, there's a number of people who checked the box the first time, or maybe didn't even get that far, right? We're like, I'm not even checking the box. And, came back and, had gone through that experience and said, no, I need to do it differently. It's not just about checking those boxes. And how can I do it differently this time?
And I bet those stories, when they get shared in the community, are really meaningful for the other participants.
It's really meaningful. Yeah, it really is. I think for them to know that they don't always have to be perfect, right? That they can make a mistake, that they can struggle, that they can, that there's still an opportunity for change moving on, and so we try to, one of the mottos that the judge always says is do the next right thing, right? So if you make a mistake, okay, you made the mistake, but it doesn't mean you have to make the next mistake. You can do the right thing, the very next choice you make. So.
Right. Don't let one mistake downward spiral you.
Exactly.
Do the next right thing so you
Exactly.
can figure out the upward spiral
Exactly.
again.
And I think it's hard, right?
It is hard.
I think for all of us, it's hard to get back on the track, right?
Mm-hmm.
But, we really want to let people know that we believe they can, that it's possible, they've seen other people do it, and then kind of encourage them to take those little steps to kind of get back on track and moving forward.
Yeah, we call this show the Empower Hour,
Yeah.
right? Because our mission at Greater Nashua is about empowering people to lead their most fulfilled and satisfied in life and reaching their potential. And it really sounds like that is the program.
Mm-hmm.
Right? Like,
that's what we want it to be.
Yeah.
That is what we want it to be. And part of it, we didn't talk about this, but part of it is, we're taking people into the program who are, some of the more challenging criminal offenders, right? Who they have a long history. They're not, they're some of the more complex and difficult substance use issues. And those are the folks that we want to take in, because that's who the program works best for, because it really is about transforming the whole life.
Yeah. Yeah. Okay. Say more about that. So it's not somebody who this is their first offense and has a possession charge, for example.
Right. So, the example I use is, it's not the college kid home on break who gets caught with a bag of marijuana. No, that's someone who's going to go through the legal system. They can be diverted earlier, maybe get some treatment, or maybe the threat of just having the legal system is going to kind of scare them straight. The folks we work with are, people who recidivate at a really high level if things don't change. Substance use disorder is one of the risk factors for criminal behavior, but there are others. And so they have, a higher risk in those. They have greater risk factors to recidivate. And so we work with them around those. And
I know one that the program talks a lot about is trauma.
Yes.
That a lot of the individuals that are in this program have significant adverse childhood experiences or trauma in their histories that is part of their journey into using and engaging in criminal behaviors. And so we're addressing that along the way too.
Yeah, so we have to help people who've had trauma and are experiencing, ongoing symptoms related to that trauma, that can really impact their ability to engage in treatment or to be successful in the long term, in abstaining from substances. And so we have to address it both when they start treatment and as they're going through treatment so that they can, manage it so that they feel so they can be successful in the long term. And the same with other mental health issues as well. So we really do have a lot of focus in our program on working with folks with co-occurring disorder. And I think being part of the mental health center, really helps us be able to serve the people who have a co-occurring disorder. So a mental health disorder and a substance use treatment disorder.
Right, that whole person idea.
Correct,
again, that
yeah.
we're not just treating a substance use disorder, we're treating whatever is maybe brought the person to it, as well as providing them the resources they need to move through it and recover.
Exactly. And I think, a lot of substance use disorder treatment programs, don't have the capacity to do that. Maybe they're just a substance abuse treatment program, maybe they're a small program, and so somebody who has both a mental health disorder and a substance use disorder, it might be really hard for them to do that substance use treatment program without support around the mental health issues. And so we really work to provide that.
Yeah, and I know there's a lot more recognition of that in general than there had been in the past. But I do think, especially when we're talking about drug court participants, again, it's not I'm in college, I'm depressed, I tried drinking and got in trouble.
Right.
Like that type of co-occurring, a little depression and alcohol use, still problematic, still requires support and help, but is not who we're helping. I mean, we're helping people that have tried to get help before that it didn't help.
It didn't help. I think one of the things with drug courts that they always talk about is it's treatment plus accountability, too. And so, and the need for a really intensive service package. So we try to incorporate all those things into drug court,
Yeah, it's such a great program. Such a great
It really
program.
is. It's inspiring to see the work that is done by the participants and how hard they work, and where they head out to. We've got, like I've mentioned, we have graduates we know that are very involved in the recovery community and passing it forward, or working great jobs, and responsible for other people in their workplace or whatever. So it's really exciting, and the team is so good. Like, our team is so motivated to just provide the highest quality service they can to people in the program, and we owe them that because they're required to do this program now, right? So we owe them a good program to do.
Right, well-trained, following the research, the data, making sure we're doing the right thing.
Exactly.
We're doing the next right thing for them.
Exactly.
Yeah. I love it. And I'd love, if somebody is listening, watching, who is thinking, oh, I want to be a participant, or I wish my family member would be a participant, or do you have any golden nuggets or something of just wisdom you might share with someone
about
just how does somebody make that transformation, or what's a first step? Or
so I think, for me, I think that from what I've seen, the first step is to get connected. Get connected. Find someone to get connected to, and be open with them. Be open with what you're struggling with or what you're doing, because that's the only way to start moving forward. And I think once you kind of build that connection, then you can build other ones. So whether it's, calling up Greater Nashua Mental Health or another treatment provider, or walking into a recovery center and seeing a peer recovery coach, or walking into a meeting, get connected.
Yeah, so that the first step to maybe being empowered, people might not feel is very empowering, but is to know you're not alone.
You aren't alone.
And to just be honest and find somebody to get connected to.
Yeah. And I think, I'm looking at it from the outside, right? But I think that most people out there, whether they're a peer or whether they're a professional or a family member, they do want to help, right? They do if someone's struggling, and so just empower yourself to reach out and to ask for help.
Yeah, it's so good, because I think like you were saying, when people are using, they're not always thinking right, and so it's easy to fall into that trap of people don't care. I'm in this by myself. It'll never get better. But that's not true.
That's not true. Yeah. Yeah.
It's
And I
just
know
not
it,
true.
it feels that way at the
It
moment,
does.
right? Because you're in a really bad space and a really bad place. But there is hope, and people do recover and lead really happy lives and fulfilled lives.
Yeah, I think people recover a lot more than we know.
Yeah.
Because a lot of people historically have kept their struggles secret, but there's a lot of hope and a lot of good that can come out of this program or other programs and other treatment.
Yeah.
Wow. It has been a delight talking with you about drug court. I feel like, going back in time a little and remembering.
I know you miss us, right?
I do miss you all. It is true. And it's just so great to watch it continue to grow and blossom. And know that it continues to help people and transform lives. So
it's a great program.
It's a great program. So thank you for sharing.
Thank you for having me
about it, and thank you for watching, listening, and being with us on Empower Hour with Greater Nashua Mental Health. And we hope that you have an empowered day.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.